Wanda Robinson is a founder and educational strategist of Pivot Health BDA, where she leverages her health and science expertise to design innovative, evidence-based health education programs and workshops. With decades of experience in education and affiliations, including the NSLS and Ignite Bermuda alumni, she is known for dynamic presentations that empower clients through practical, hands on learning. Guided by her belief that pursuing purpose is worth it, she equips and inspires others to advance health education and create meaningful, lasting impact. That was an interesting bio, Wanda, and the stage is
Thank
all
you.
yours.
Thank you. Thank you, Melinda. Thank you for this opportunity. Hello, everyone. Thank you for joining me. We're going to jump right in. Melinda, if we can start with the first slide, please. Now, I'm not sure if you, okay, here we go. Okay, I'm seeing all of the slides, Melinda. Are you able to go to the very first one by itself? Where it says slideshow. Click on slideshow. There you go. Okay.
Sorry, Wanda, there was an error, I think. It's not working. Slideshow is not working.
Uh-oh. Okay. Is everyone able to see everything else, though?
Yeah, is.
Like,
Yeah.
okay, so can we go along as it is then? And can you click on each one individually? Let's do it
Yeah.
that way.
Yes, yeah.
Okay. All right. So my apologies to everyone. It doesn't seem to be working correctly. But my name is Wanda Robinson, as Melinda introduced me. Thank you so much. And my topic today is health education. Is collaboration the key to improving healthy outcomes in diverse communities? I'm going to first start with the second slide at introduction. I would like for you to close your eyes for me. And I want you to imagine a time when you were in a doctor's office, a dentist's office, and they gave you some information. Did you leave that office feeling more confused than when you walked in? And if you did you go and try and research it for yourself? Did you get home? Did you take a look at everything and wonder, okay, well, I can't figure this out on my own? Well, this is what I do as a health educator. I help educate you. So Melinda, I'm going to look at them on my computer as well, so I can see them a little bit larger. Some of you may not be able to see these, so my apologies for that. One of the quotes that I love, you can't teach people everything they need to know. The best thing you can do is position them where they can find what they need to know when they need to know it. That's on slide 3. And that's by Seymour Papert. Seymour Papert was an educator as well. Slide 4. Health education access story. This is a personal story of mine. Back in the 1980s, I had a childhood friend who went to the doctor and needed to find out what was going on in her body. The doctors took a look at it and they decided, okay, well, we think it's something communicable. And they treated her for those things. You see, what she had was not something that was understood in the 1980s. So it wasn't the doctor's fault. They just were treating the symptoms that they saw. And health educators were not around at that time to the extent that they are today. So she had her first treatment and lived 10 years after that. And she had her second treatment back in the 1990s. At that time, people were beginning to find out that what she was suffering from was actually a non-communicable health challenge. Unfortunately, her body couldn't take anymore, and she passed away. So that was a good friend of mine. And to this day, I see people who are going through challenges such as hers, and they're thriving because the knowledge of this health challenge is more widespread. What was this health challenge? It was lupus. So lupus was affecting her body in such a way that the medical professionals had no clue what it was because they didn't fully understand it yet. She needed a health educator. Slide 5, the history of health education. So let me track back a little bit in order to move forward. There were two gentlemen who were known for health education. One was Thomas Denison Wood. He lived between 1865 and 1951. He was called the father of health education, and he mainly worked in schools. The second gentleman was Clare E. Turner. He lived between 1890 and 1974. He was known as the pioneer of health education. He developed the profession. So this collaboration between the two of them happened over many years. Thomas and Wood, he basically founded health education, and then Clare E. Turner took his information and moved it forward and developed the profession. Now, I will say that health education has been around for centuries, but it's been in the homes. So every generation has shared their knowledge of health education within their own homes. Let's go to the next slide. The health educators' 8 areas of responsibility. We have responsibilities. We must assess the community. We must assess our clients. We must assess to see what their needs are. We then must plan a plan of action. What is it that we're going to do in order to assist the individual or the community? And then we must implement. Implementation is important in any community in order to make a difference. And then we look back and evaluate. Was this effective for that community? And then we advocate for those within the community and for those outside of the community who want to come in and assist. And then we communicate. We communicate the information that we found out about that community, their needs, and how we can assist. And leadership. How do we lead to ensure that the community gets what they need? Now, the 8th area, ethics and professionalism, that was required so long ago. And this was added in 2020. It's so important in this day and age to ensure that you are effectively helping others with ethics and professionalism. Next slide. Health educators and employment. Where do health educators work? They work in communities, they work in schools, they work in public health departments and or nonprofit organizations, and they work in hospitals. Next slide. We're going to talk about the benefits of health education. There are many benefits within each group, each community, each educational institution, each hospital, each public health department, and each nonprofit organization. We're going to take these separately now. Within the community. The community first, the health educator has to assess the health needs of the community. What is it that the community needs? Based upon their financial structure, based upon their health, based upon their backgrounds, based upon their education, what do these communities need? What program design would work for this community? And how would we effectively implement this in that community? And then how would we promote it? How could we promote this health program within the community? Next slide. Educational institutions. You see, health educators also work in educational institutions. We help develop curriculum. You have students who will be in a health program, and you have students who will be in a restaurant program. And we would need to help with curriculum development to effectively serve those students. We implement wellness programs so that students will come in. They may have challenges, they may have wellness challenges, but they'll be given direction as to what foods to eat, what exercises to do, and how to better their health. And we encourage healthy behaviors. So what choices are these students making? Do they go to the famous side store and buy the chocolate and the chips and the burgers and the French fries every single day? Or do they choose to eat more healthy? Health literacy and advocacy. This is a big one. Health literacy means that they understand the terminology. So if you have someone studying nursing or studying medicine or studying any health field, they are able to understand what the terms mean. And then they're able to teach others and advocate for others, whether it be through community service, within their own families, or their friend group. Next slide. Hospitals. Within hospitals, well, the focus is patient wellness, right? So when a patient goes into the hospital, they are going in with the intent to leave healthier. So health educators get into the hospital and they support that patient with all of the knowledge that they need to get through the process. For some, they may walk in emergency and walk out the same day. For others, they may actually stay in the hospital for longer periods of time. Illness management. And this is where the longer periods of time come into play. The patient may go in and need more assistance in order to become well. For some, like my friend, her illness management went on for many years, over a decade. And she went in for the last time. For her, unfortunately, she didn't come out the same way she went in. But there are those who do. They go in and they successfully get through the treatment. And you may know some people who have done. Who knows? Any of us could be that person who has gone in and come out even better than before. Patient or case-specific education. So when a patient goes into the hospital, the health educator is there to help support them when the doctors and the nurses don't have the time to do so. That's a very important piece because there are many patients who go into the hospital. They may have something that the doctors or nurses need time to explain to them, but they just don't have the time. That's where the health educator comes in to help educate this patient as to why they have a tray of food that looks all green. It's all vegetables. Or they have a tray that has no sugary things on it. The health educator helps to explain all of that and takes the time to hear the patient. Medical translation. This is an important one. I think of someone who has diabetes, for instance. A medical professional may go in and say, type 1. And this person may not even know what type 1 is, or type 2. And they may have no clue, or gestational. They have no clue what those terminologies mean. The health educator has the time to explain that to them, what type 1 is, what type 2 is, and what gestational is. Now, if they come in and say gestational and the person is 80 years old, that may not be the medical translation that they want to hear, because gestational diabetes happens during pregnancy. Assisting with lifestyle changes and maintenance. The health educator helps with that. So when the patients are getting ready to leave the hospital, or even if the patients are outside of the hospital, their clients, then they help assist with making lifestyle changes, the planning of the foods and the meals, the planning of the exercise, and also the maintaining of all of that. Now, do the health educators do this on their own? No, they don't, and we'll get into that soon. Public health departments. The public health departments, this is the next slide, slide 12. The public health departments are a larger entity, and they bring everything together. They develop the programs and design the programs for the community on a wider scale, and they help implement these programs on a wider scale. This involves doctors and nurses and dietitians. A whole large amount of people come to assist with this. Program evaluation. They take all of this information, once the program has been designed, once it's been implemented, they then go back and evaluate it to find out, did this work for this community? And if it did, we need to keep going. If it didn't, what do we need to change? That's where the health assessment comes in as well. The health assessment can be done before they start, and it can be done after they finish. So it assesses the needs of the community prior, and post, it assesses, did this work? So that's part of the evaluation as well. And the data analysis. The data analysis can be in many different areas. It can involve age groups. It can also involve the socioeconomic groups, many different groups, and also any preconditions that the person had. Next slide. Finally, nonprofit organizations. These organizations are almost like that extra hand that all of the other organizations need. Nonprofit organizations, they do outreach education. So where the hospital can't do it, where the public health department can't do it, where the educational institutions can't do it, then the health educator may work for the nonprofit organizations and help with outreach education. Resource development. Now, I think of the American Diabetes Association. They are famous, and many diabetes associations all over the world. We have one here as well. They develop resources for the community. So when no one is available to assist them personally, they can get these resources either online or even as different pamphlets or books. Next slide. Now we're going to talk about diverse communities. When we talk about diversity, we're thinking about differences. Every community has different people in there. Every community has different belief systems, all of that. Within diverse communities, first, we're going to discuss age. Age can range from anywhere from birth to over 100 years of age. But we must make sure that we're using the proper terminology for those who are of those ages so that they can understand. Communication, and that's where communication comes in. What terminologies are we using? How are we communicating? Through facial expression, through body language, through words? How are we communicating the health information to the communities? Culture and race. This is a big one because many cultures and different races have different terms that are acceptable to them, but their terms may not be acceptable to others. So we must be aware of those cultures and of those races if we want collaboration within those communities. Religion. I love to pray. That's who I am. With my friend, that's what I did for her. I prayed a lot for her as she went through her challenges. Did my prayers get answered? Yes, they did. She was given a longer life because I knew where this challenge was taking her. So for many pray and some don't, and that's okay. But to respect the religion of everyone within diverse communities when it comes to health education is very important. You may see someone who doesn't want prayer, and you have to respect that. But you may see someone who needs it, and you have to respect that as well. But diverse communities still need health education. Socioeconomic differences. This is a huge one also. Socioeconomic differences reference to those who are in the social categories and financial categories that may be higher or lower than other neighborhoods. And it's not to say that they don't deserve the health education. No, it means that they do. They do. And they may need a bit more understanding. And that's where the health educator comes in. The doctor may not be able to go up into a neighborhood where the people don't want the doctor, but the health educator may be able to. Next slide. The importance of collaboration. Healthcare systems and healthcare education, when the two are paired together, you have increased efficiency and patient-centered care. How many of you would want your family member who's in the hospital to have that patient-centered care? That's why health education is so important, to pair it with the healthcare systems. This also decreases hospital readmissions, and it decreases healthcare costs in the long run as well. It also improves compliance with health policies. With all that we've gone through over the many years of health challenges throughout the world, we would love to see decreased hospital readmissions. We would love to see decreased healthcare costs. And we would love to see improved compliance with health policies. Collaboration. Here's another part of collaboration. This is slide 16. It improves patient outcomes. That is a huge one. When we collaborate, the health educator, with all of the medical and health professionals, it improves patient outcomes. It supports interdisciplinary teamwork. Within a room, everyone that's involved in any particular patient's case are able to have teamwork between them. It promotes community engagement. You see, if you go into a community and you see the doctor, you see the nurse, you see the physiotherapist, you see the counselor, you see them all present, working together in one community. That encourages the wider community to engage with them. It also enhances disease prevention. How many of us, if we were told everything that goes into our mouths, we have to be careful of, from the candy, all the sugary snacks, to the burgers, to all of the starches, we have to be careful what we eat. How many of us would have really listened when we were younger if the health educator sat us down and really told us what it meant. Because everything that we put in our mouth affects our bodies in different ways, whether it's positive or whether it's negative. So collaboration across the board is so important. Here's a real world activation on the next slide. I am a co-founder of a summer camp. And 2 years ago, I was afforded the opportunity to create a health program for the students. There were 10 of them for this round, and the ages ranged from 4 to 13. The parents were quite excited about it. So was I might add, and so were the children, especially when it came to food, I have to say. They were very excited. We did different exercises. We did walking and running, we did football, we did frisbee, we did catch, and we did healthy cooking and baking. Some of the students were able to participate in the exercise and others were not, only because they had health conditions such as asthma, bronchitis, different things they had issues with. So some were able to come and some were able to just kind of sit on the side, or they may not have been able to come at all. However, the students were able to be educated about the lungs, the heart, the blood vessels, and even what it means when someone has asthma. We even had one child who, when we did some healthy baking, they bought in their own flour because they had an allergy, a wheat allergy. So the students were able to learn about wheat allergies. They were able to learn about what it means to use gluten-free flour. They were able to taste it. Did they like it? Not too much, but they were able to try it anyhow and understand what this student was dealing with. Next slide. Now I have an imagine activity for you. I want you to imagine the favorite person in your family, that person who is your absolute favorite. You cannot do anything without calling them or seeing them. They are the best person to you. Now I want you to imagine that they had a need, health-wise. How far would you go to ensure that they had their needs met? You go to the doctor's office, you sit in the room and you listen to what the doctor has to say. Would you just take that information and then leave them on their own? Or would you take that information and would you go ahead and research it for yourself? And as they go for their follow-up appointments, you ask questions so that you can get some answers in order to assist them. Now, they're your favorite person, right? They're your absolute favorite person. So I know that you will go and assist them if you could. That's what a health educator does. Every client is almost like our favorite person because we want to see exactly how we can assist them to be healthier and to thrive and to live a long life. Next slide. Now, there are some challenges with collaboration. With every success, there's always a challenge. Communication is one. We have many different cultures, many different languages, many different belief systems, but we must learn to communicate effectively. What someone may hear as Down syndrome, someone else may hear as trisomy 21. Two different terms to some people, but they're very closely related. So we have to be able to describe, okay, there's an extra chromosome present. We have to be able to describe, well, this is what this means. The roles within the room, you have doctors, you have nurses, you have physiotherapists. Everyone's role must be clear. You cannot have a physiotherapist given a patient direction that a doctor has to give. The physiotherapist works along with the doctor. They have the knowledge, yes, but their knowledge goes together with the doctors and so on. Resources. Resources are very important. When that patient goes home, they need to know, where can I find more information? How can I read more? And how can my family help? And time. Time is a big one. Not every doctor has the time to sit in and listen for long periods of time. That's where the health educator comes in. And that's where the team comes in when that patient needs assistance. There are strategies to strengthening collaboration, many strategies, and these are just a few. The health educator links all of the other professions by care planning meetings, by community outreach programs, and this is slide 20, and share patient education materials, conducting interdisciplinary trainings, establishing measurable health goals, and these are just some, to name a few. Next slide. Here's an activity for you, a question to ponder. Who is the health educator in my community? Who is it? Are they the medical doctor or the dental professional? Are they the qualified health educator? Or are they the generational person who has the wisdom and the knowledge? Who is your health educator in your community? So, in summary, I want to say that health education has steadily grown into a profession that will benefit individuals, health professionals, and communities who need extra support for that longevity. The issues surrounding health education requires a holistic approach to ensure that all relevant stakeholders in the community and all those invested in communication and collaboration for the health of their communities, for all of them to come together. Collaboration with health education is essential for promoting preventive care, improving patient outcomes, and strengthening public health systems. By working together, healthcare professionals and health educators can create healthier communities, reduce disease, reduce that burden, and empower communities. Effective health education is not an option, it's a necessity in order for us to move forward with a healthier community. Health education is collaboration the key to improving healthy outcomes in diverse communities? Well, the answer is a resounding yes, it is. Thank you for listening. We'll go to the next slide. I have some of my resources. I would encourage you to take a look at the resources and read some information for yourself regarding principles and the foundation of health promotion and education. Also, read some more information about Thomas Denison Wood and Claire E. Turner. Very interesting information. Thank you. If you would like to connect with me, you can find me on LinkedIn. And I do have attached to my slide a QR code that you can scan if you are able to see it. If not, you can just type in my name, Wanda Robinson, or you can type in Pivot Health BDA. All right, and my email is wrobinson@pivothealth, that's PIVOTHEALTH.BDA.com. Thank you for listening.
Yes, Wanda, thank you so much for your wonderful presentation. And we have
Thank you, Melinda.
our audience, Wanda.
Yes,
Yeah, I want to ask you one of them.
yes.
Okay. How do we measure the success of collaborative health education programs?
Okay, could you say that one more time, please?
How do we measure the success of collaborative health education programs?
You can measure that by, and thank you for that question. You can measure that by going ahead and doing a, oh, the word just left me that time, Melinda. Sorry. You can go ahead and just measure that by going to the communities and asking questions of the communities that you are serving. So you can do a poll within the community and find out if that program is successful or if it was successful for that group of individuals.
Thank you for answering the question, Mona, and
You're
thank you
very
so
welcome.
much for your valuable time. It was a really energetic session. And,
You're welcome. Thank you.
and please be on the backstage and join the next session, Wanda.
I will. Thank you.
Bye bye.
Okay. Bye bye.